Hi, everybody. So we're going to talk about Alzheimer's and music therapy as treatment today. The reason I want to research Alzheimer's is because I feel like memories are some of the most important things we have and make up who we are as a person and our experiences. And just losing those memories and our ability to think and reason, it just takes away our humanity. And I think Alzheimer's is a a cruel disease that has no cure or link to a specific cause, and it slowly takes away who a person is even before they pass on. What is Alzheimer's? It's a type of disease, a type of dementia, which is an umbrella term that describes many symptoms related to a decrease in memory and ability to think. So Alzheimer's is specifically affecting memory, thinking, and behavior. In our brain, we have specific areas that relate to specific functions, and in each section we have neurons, and Alzheimer's specifically destroys neurons. It builds up plaques and tangles, which are plaques are clusters of protein that is found in the membrane along a neuron. So the membrane, the protein comes from that membrane, and it bunches up into a cluster between the nerve cells. And we also have tangles that is made up of a protein called tau, which usually lies flat and along together like a violin bow, like the horsehairs on a violin bow. But in this case, they are tangled up and bunched up, and those you can see in dying or dead nerve cells. Symptoms would be trouble recalling new information. There would be a slower thinking process, confusion and disorientation, memory loss, and behavior changes. The three stages would be mild, moderate, and severe Alzheimer's. Mild, you would occasionally lose familiar words, forget new material, and misplace everyday objects. Like you brush your teeth every day, so you would maybe lose your toothbrush. Moderate Alzheimer's would be coming withdrawn or lost. You would forget personal information like medical history, birthday, your middle name, changes in personality, and changes in sleep habits. And severe Alzheimer's requires the need of constant aid. You would not be aware of your surroundings, or even if somebody's trying to speak with you, you would not be aware of that. Decrease in communication and other physical functions, and you would be more exposed to illness because of the deterioration. Who is at risk? So people the age of 65 and older are usually more susceptible to the disease. It's not unheard of for anyone younger to have it. Those with family history of Alzheimer's would be at risk. There are two categories of genes called risk genes and deterministic genes, and you can find an Alzheimer's gene within those categories. So anyone who has that would be more at risk. And there's also a potential risk for anyone who has had a head injury or heart issues or heart damage. This wouldn't be, at the age of 20, but if you've had it in the past, when you get older, you could be more susceptible because of the blood flow between the heart and the brain. So living with Alzheimer's, your brain shrinks over time, losing function. If you want to look at that diagram on the right, you would have memory loss and sleeping and behavior changes. You would have confusion and disorientation, not knowing where you are, not knowing who someone is, baseless suspicions, so thinking someone might be out to get you for no reason, that somebody took something of yours without reason. You would be suspicious. You would have the inability to converse or communicate, to carry on conversations. You would be depending on your family and your caregivers, especially with the severe stage of Alzheimer's. There would be emotional trauma for both you and your family going through the deterioration and the frustration of the disease. And there would be a decrease in physical abilities over time. It might be more or less severe depending on the person, but that is something that can happen. Treatment approaches. There is no cure for the disease. There's no treatment that delays or stops the progression of the disease itself. There are medication treatments that can help slow the progression of the symptoms of the disease. For that, there are cholesterol inhibitors, and there's a drug called memantine. These are something that regulate the activity of certain chemicals And if you jump down to that last bullet point, it talks about early diagnosis. That's very important because you might be able to benefit from medicated treatment. For example, when you have, your second month of disease and you're only needing 20% more of the chemical, the drug introduces 50%. That will help you maintain kind of your memories and your thoughts. Whereas, 2 years down the road, you might need 60% of the chemical, but the drug only helps provide 50%. So you wouldn't benefit as much. Jumping back up, there are non-medication treatments for behavior and sleep. Both of these are geared more towards the caregivers and family because they are the ones in control of the treatment. For behavior, they suggest disarming actions or responses because the person who has the disease might not be aware that they are being rude or agitating or whatnot, but it's up to the family and the caregivers to understand that it's not their fault and that they have to be disarming. And for sleep changes, again, geared towards the caregivers, it encourages helping them maintain a regular sleep schedule and encouraging a healthy lifestyle. So giving them exercise, outside, having sunlight, and avoiding the intake of caffeine and alcohol. So again, like I said, early diagnosis increases the chances of benefiting from medicated treatment. There's also a better opportunity to join clinical trials because then they can study the disease, what causes it may be, and how it progresses in each person. And then it will also personally allow more time to plan ahead with your family and your friends and your loved ones. So talking about what is music therapy, the definition that Kenneth Brescia provides us is kind of long. So I'm actually just going to jump down to my definition that kind of sums it up a bit. A practice in which there is a trusting client-therapist relationship engaging in music experiences in a comfortable environment for the benefit of the client's mental and physical health. So both definitions cover the use of music, that there is a relationship formed between the client and the therapist. Overall, it is designed and intended for the improvement of the client and their health. So like Alzheimer's treatments, music therapy is not a treatment that can stop the disease or slow the progression of the disease. But like other treatments, it can help in temporarily decreasing other symptoms. Most everyone who suffers from Alzheimer's are older, 65 or older, and they can participate in group therapy or individual music therapy. So to briefly go over that, music therapy for a group is exactly what it sounds like. A music therapist would lead each session, and this can include other clients or caregivers or both or family. And they can sing and listen to familiar songs or even songs that they're not aware of. They can add their own voice and their own expression in the music. They can improvise, so the therapist can provide sections of a song where the client can write their own stuff. And you could do call and response with instruments or even with singing, where the therapist would play a pattern and the client pays it back, or they could also improvise their own. And again, this is with a group, so everybody can do it together, or they could take turns and interact with each other. This would be helpful for social communication. And then there's also individual music therapy, which is more one-on-one with a client and therapist. Some people might choose this. They might be more comfortable doing that because they don't like being vulnerable or exposed. They don't want to improvise in front of other people. It's kind of a personal preference, and this can lead to maybe a more in-depth session, a more emotional session, and this can use similar interventions like improvisation and call and response like group therapy. So all methods of music therapy involve music making and involve reflecting on music. They aim to improve the physical or mental health of the client. Sometimes it's both, sometimes it's one or the other, but overall it's to improve their health. Some examples of therapy goals would be to help in recalling memories, increasing physical movement, improving communication skills and conversing skills, and improving the mood of the client. Now, this can be long-term sometimes, but often it's a temporary solution. some sources and articles and data has been reviewed. Katrina Parent read some articles, and in her article, she says that there are signs of improvement in interaction because of music therapy, but that there needs to be more research done with longer time frames to determine really what improves and why it improves. Another article that I read talks about different techniques that are analyzed and found to have different positive results. So listening to music that is like classical can slow the decrease of cognitive abilities. Singing music that people are familiar with would show better results than singing music that they're unfamiliar with or that evoke different emotions. And listening to music just in the background can help ease anxiety and improve memory recall. Looking at the kind of more neurological benefits as to really kind of what goes on in the brain. It's not exactly clear, but these are some different opinions of people who have conducted different researches. So the first one is that singing training could improve the neural efficacy of cognition. Music might play an important role in the neuroplasticity mechanism. The second one is that there is a relationship between music and steroid hormones, and regeneration and repair of neurons could be possible by listening to music. So this is saying that because of the relationship between music and steroid hormones, that leads to a reparation of neurons when listening to music. The other one, music can promote neurotransmitters to release certain hormones that encourages socialization. So the neurotransmitters that are released by music can release the hormones that make people want to talk, make people interested in communicating. And the last one is that there is the opinion that it's actually emotion is that what improves cognitive test scores in the studies rather than the music. It says neuropsychiatric symptoms associated with music had a great effect on semantic memory. So it's not saying that the music itself is improving the memory, but rather what emotions we feel are what improve our memories. So overall, I would say, again, Alzheimer's is a cruel and unforgiving disease. It takes away who we are. There's no cure and no treatments. There's some treatment that can slow the symptoms, but nothing that can actually stop the disease. I'd say music therapy is a valuable treatment. It's non-pharmacological method of treatment, and it helps to relieve the symptoms, but it also provides a happy and joyful escape from the devastation of the disease. It brings people happiness. It's a different approach that's not medicine, that can have side effects that make people feel bad. Most times it's a very kind of happy form of treatment. And these are all my resources. I got most of my resources from the Alzheimer's Association in researching the disease. But this was a pretty good project to do. Thanks.